Have you ever skipped your period for an entire month without being pregnant? Or had a cycle that seems completely out of control, either arriving too often or dragging on endlessly? You're not alone. I've spent countless hours diving into research and consulting top doctors from Harvard Medical School to uncover the real reasons behind irregular periods. Stay with me, you won't want to miss this. A normal menstrual cycle lasts between 21 to 35 days. But if your period is unpredictable, comes too late, too soon, or lasts too long, you may have an irregular cycle. This can be caused by hormonal imbalances, stress, poor diet, or underlying health issues. Common types of irregular periods. Let's talk about the most common menstrual disorders. Oligomenorrhea. Long cycles, more than 35 days apart. Polymenorrhea. Short cycles, less than 21 days apart. Menorrhagia. Heavy periods, soaking through pads every 1 to 2 hours. Hypomenorrhea. Extremely light periods, only lasting 1 to 2 days. Amenorrhea. No period for more than 3 months. Spotting. Bleeding between periods, which could indicate hormonal issues or fibroids. If you experience any of these, tracking your cycle and making lifestyle changes can help. Having irregular periods can be frustrating, especially if you're trying to conceive. But don't worry, your body can naturally rebalance itself with the right lifestyle changes. Here are some simple and effective tips to regulate your cycle and boost fertility. Reduce stress. Relax to balance your hormones. When you're stressed, your body produces cortisol, which disrupts estrogen and progesterone levels. So, how to reduce stress? Try meditation or yoga for just 10 to 15 minutes a day. Get enough sleep 7 to 8 hours per night. Take breaks and enjoy your hobbies. Tip: a cup of chamomile or ginger tea can help relax your nerves. Eat right. Balance hormones from within. Your diet has a direct impact on your reproductive hormones. Foods to eat: omega-3 rich foods, salmon, flax seeds, walnuts. Dark leafy greens, spinach, broccoli for iron. Whole grains and nuts, oats, chia seeds for stable energy. Zinc-rich foods, oysters, pumpkin seeds for ovarian health. Foods to avoid. Caffeine and alcohol can mess with hormone balance. Refined sugar spikes insulin levels, affecting periods. Tip: a warm glass of lemon water in the morning helps detox your body and regulate hormones. Maintain a healthy weight, not too low, not too high. Both underweight and overweight conditions can disrupt your cycle. What to do? Eat a balanced diet instead of extreme dieting. Exercise moderately. Walking, yoga, or swimming are great choices. Tip: a stable weight helps your ovaries function better and increases fertility. Exercise the right way, not too much, not too little. Regular movement keeps your cycle regular, but excessive workouts can stop your period. Best exercises for menstrual health: yoga or Pilates. Improves blood circulation. Brisk walking, 30 minutes daily, reduces stress. Swimming or cycling, gentle yet effective workouts. Avoid excessive high-intensity workouts if you experience irregular periods. Tip: deep breathing exercises every morning help balance hormones naturally. Herbal remedies to regulate your menstrual cycle. If you're looking for a natural way to balance your cycle, certain herbs can support hormone regulation and overall reproductive health. Chasteberry Vitex ognoscastus helps balance hormones and supports ovarian function. Ginger stimulates blood circulation and reduces menstrual cramps. Cinnamon helps regulate blood sugar levels, which is beneficial for those with PCOS, polycystic ovary syndrome. Tip: drinking ginger or cinnamon daily can help improve menstrual regularity and ease symptoms of irregular periods. When to see a doctor. If your period has been missing for more than 3 months, you experience extreme pain, or have excessive bleeding, consult a doctor. Irregular cycles can sometimes be a sign of PCOS, thyroid issues, or other health conditions. I hope this video helps you understand your cycle better. If you found it useful, please like, share, and subscribe for more health tips. Let me know in the comments. Have you ever experienced irregular periods? What worked for you? Thanks for watching.